Hi, thank you, Emma. Good morning, everyone. I love and enjoy this meeting the most of all the meetings I attend. And that's because I think we come together from different countries and listen to issues that are ongoing across the cancer care community. And disparities exist both in low and middle income countries and high income countries, as we have seen. I'm going to take you to right to the frontline workers, how we are making an effort at the current center that I'm in, which is BALCO Medical Centre, which is a center in central India. And this is the hub of the program that we are trying to do. It's a 170-bedded cancer center started in 2018 by the Vedanta Group. It's not for profit and has all the national accreditations that are needed. If we look at the health landscape of India, as you've seen, we are leading the world in scientists, in drug development, in generics, in manpower. Yes, we do have challenges. And the key challenges we face today are malnutrition, which is overnutrition in the urban India, and undernutrition and anemia in rural India. And also the growth of non-communicable diseases, which I will touch upon. So I think what we need is affordable and accessible healthcare across the country, especially rural India. 70% of Indians still live in rural India. And one of the sad reality today is, I would say 80% of Indian healthcare is delivered in the private sector. And most of the oncologists are concentrated in urban India, in Indian metros. The priority areas for us are hypertension, 1 in 4, cancer, anemia, as I said, diabetes and nutrition. And these are growing, especially cancer. 1 in 4 of us, as per the statistics, is going to develop cancer. If we look at central India, I work in Chhattisgarh. It is a state in central India, and Madhya Pradesh. 30% of the people living there are from tribal populations. They live in very remote areas with very difficult access to cities. And the common cancers, as per the data at BMC, about 24% are head and neck, breast, and cervix. And of the patients that we have screened, I looked at the data between July 2022 and October 2023. 1 in 4 individuals we suspected were diagnosed with cancer. And about, I would say, 80% of the patients who present to us come in stage 3 or 4 cancer. So how do we change the dynamics? The 5-year survival in Northeast India for cancer is 25%. In rest of India is about 60% compared to, if you look at high income countries, it ranges from 80 to 90% based on the Concord data. In central India, it's about 30 to 40%. And all of that is linked to late diagnosis. So what we are trying to do is we're trying to work on these 3 fronts: increasing cancer awareness in the frontline workers, doing camps with Nandaghar, I will talk about a little bit, and a mammography van as well. So these are the people who actually will be the facilitators in helping us deliver the care in rural India, because ASHA is accredited social health activist, Anganwadi workers, primary care doctors. We have a lot of homeopathy doctors, Ayurveda doctors, and people in the villages trust them, because they go and have a cup of tea with them. They are there with them when somebody has died, somebody is born, they celebrate with them. They are there with them the whole time. So they will not trust me, but they will trust the people who sit with them, eat with them. And I think this is what we need to do to be able to change the diagnostic dilemma from stage 3 to 4 to stage 0 to 2. And this is what we are trying to do at BMC. We have engaged with schools and universities because I saw an 18-year-old girl just 2 weeks ago. She had a cancer in her palate, and it was very unusual. It's tobacco-related cancer. So she used to get the tobacco for her father, and she would just put it in her mouth and suck it. So she'd been sucking it. So she got her cancer in her palate. And so we need to drive it right from the school level about tobacco cessation. Menstrual hygiene is a big issue in Indian villages. Ladies still go around a pond, it's called a talab, where they go and bathe in groups and not using pads still. HPV vaccination. So these are the three things we are targeting, and starting from kids from 12 years onwards. The nurses and our paramedical staff do skits in villages. The two skits we've designed, which they have done, is self-breast examination and hand hygiene. And the next one we are working on is menstrual hygiene. It's how we do it in a way that it's acceptable and without any stigma is something that we are working on. Samvad means a conversation in Hindi. So we are working with the frontline workers. All these workers I showed you, Asha, Mitane, and Anganwadi, they're invited to BALCO Medical Centre once a month, where we sit and chat, we have a cup of tea, lunch, and then show them the hospital and show them, how the patients are cared. What is the importance of diagnosing patients early? And we are doing this in collaboration with the state government. Say no to tobacco. We are doing this with the schools. And this was the painting that won the first prize, Stop Smoking Before It's Too Late, by a 7th standard student. So the frontline workers are invited to BMC, and the whole team, not just me, takes part in. We are also partnering with local NGOs, like Ambuja Cement Foundation has works in about almost 273 villages in Chhattisgarh. So we are working with every stakeholder that there is to try and maximize the not just cancer awareness, but health awareness through screening camps in these villages. Nandghar, Nand means child, Ghar means house. So it's a collaborative project between Vedanta and the Union Ministry of Women and Child Development, and where the Anganwadis, which are already there in the villages, they are upgrading them through solar panels with television and a room where one can teach. So the focus is women's skills and empowerment and child nutrition. So we've kind of working with them. So wherever Nandghar is there, so we already have a place where we can do the screening camp. So we try and do a cancer screening camp with the Nandghars. So they have presence all across India. In Chhattisgarh, they are 262 Nandghars. So we are trying to tie up with them so that at least when we go there, the team within the Nandghar can go to the villages and already sensitize them that a camp is going to be done so that people can turn up and have access. So again, with the combined efforts, we want to meet the SDGs of Vedanta or the WHO. The aim is early detection, also deliver world-class cancer treatment for free. So at BMC, I would say 90% of our patients are from lower socioeconomic strata. About 60% of the patients are under the universal health coverage scheme that is called Ayushman Bharat, or Prime Minister's Jan Arogya Yojana. So when a patient is diagnosed in these camps, so they're diagnosed, they get the treatment at BMC completely for free. And we have also partnered with the state government so that the patient's travel and stay is also looked after. So they don't have to worry about that as well. The mammography van we acquired in June this year, and the whole aim was to drive 3 common cancers screening. So ladies above 45 years of age, they have a mammogram done and it is reported real time by the radiologist. They have a HPV, we don't do the HPV PAP DNA, but we do the simple PAP smear and a gynecological examination. If there is something in the mouth, we do an FNAC or a brush cytology. And also at the same time, we do a blood pressure, a random blood sugar and BMI, and try and inculcate that into the consultation. So 3 common cancers, breast, cervix, and head and neck. All 3 are looked at, along with trying to tackle the other non-communicable diseases as well. In phase 2, we want to actually, right now, we just look at the tongue and decide whether the patient is anemic or not, or we look at the conjunctiva. So, but down the line, we actually want to do a hemoglobin, a point of care test that we are looking at, because anemia is very common in the villages, and also formulate a nutritional strategy. So these are the various camps we had done. This is done in Bastar district in a majority tribal area. Dr. Mao saw about 82 patients and diagnosed 14 patients who clinically had cancer. And of those 14 patients, only 2 patients, despite the collector saying that they will fund all their travel stay and everything, only 2 patients turned up for treatment. They've gone for alternative treatment. Even the 18-year-old girl is not going to come for treatment. And we've tried our best. And but this is a piece that we really need to focus and work on. So I think to shift the needle from late to early stage and better outcomes, we really need to engage the frontline workers so that we diagnose cancers early. The cost of treatment is less and high cure rates and better survival. Thank you.
Thanks very much.